Firstly, thank you very much, Claire, for inviting me. It's always nice to come out and speak to Osteopaths. For those of you that I don't know, I think some familiar faces, my name is Katie Griffiths. I'm the Professional Development Officer at the Institute of Osteopathy. I am a practicing osteopath as well, so I come with sort of two hats, hopefully. Been invited to talk today a little bit just to bring people up to date around Advertising Standards Authority, some of the work that the Institute has been doing around this, and really just to explore some ideas that we're starting to think about and share with osteopaths for their views, etc., about how we actually go forward with this and look at how we can market and promote what we do, supporting the health of our patients and our community. As I said, I'm going to run through the presentation and then I'm absolutely happy to take questions, but we're going to do that at the end of the session if that's okay. All right. So I'm just going to go a little bit, this is what we're going to cover this evening very quickly, just a little bit of background of some of the issues, where our discussion started, where we are at with them now at the moment, some advice, I hope, around some communication guidance, and then looking at where we can have an opportunity to really, really inform the public about the benefits of osteopathic treatment and the service that osteopaths do, as I say, to the health of their community. We feel quite passionately about this, and as I say, we are exploring ways that we can do this. So just sort of going back about 18 months, 2 years, just to put a little bit of context on some of the issues. There was a number of complaints that started to come through from a particular organisation targeting specifically osteopathic websites, particularly around treatment, paediatric osteopathy and osteopaths, those treating pregnant ladies as well, and those utilising cranial techniques. It's quite a targeted piece of activity. They were using the information on websites to form a basis for complaint. Now, interestingly, those complaints weren't going to the Advertising Standards Authority. Those complaints were being made to GEOSC, suggesting that because of certain claims that would be made on the website, this would be an issue around fitness to practice. Now, interestingly, GEOSC's view on this is that because the information was on websites and it was to do with the promotion of osteopathic services, this was actually an advertising issue. This had nothing to do with fitness to practice. This was not about people's suitability to practice. Various conversations ensued, and as I say, the complaints did arise. From our perspective in supporting our members, what we were finding was that members were looking at their websites, trying to be compliant, but they were getting a really mixed messages from both the Advertising Standards Agency and other areas about what it meant to be compliant. Some of the advice we felt, sorry, I'm not standing in the right place there. Some of the advice we felt was, to say the least, overly cautious in the ASA trying to mitigate complaints, because that's what they were trying to do. So we entered into discussions with the Advertising Authority to really start and unpick, what is it that their concerns lay, how is their process for providing information on osteopathic service. Obviously they are not clinicians, they're not experts in these areas. They used a lot around this term of what they called implied efficacy, which was this idea or this concept of where sites made implied claims for treatment as opposed to explicit I treat X, I treat Y, but having information that they felt might imply that there was some treatment of what they felt was outside the approved list of conditions. One of the other things that we talked a lot about with the ASA was their threshold for evidence. So in ASA World, which is a broad regulator, So their regulations doesn't cover specifically osteopathy or any other healthcare. They're very generalist guidelines, which is part of the challenge. They have a certain level of evidence that they look to seek for when looking for particular treatment claims, and that does hover around RCT, random controlled trials, predominantly because they are dealing with the sort of, can this pill fix this versus this pill doesn't. Hence why they have this threshold. And certainly our conversations were focusing around how that doesn't necessarily apply to current healthcare practice, and certainly not into manual therapy, and even in general healthcare guidelines. Evidence-based medicine, as you're all aware, it is not purely based on research, but a number of different factors and different levels of best research as is available at the present time. So this is just a little bit of background of where the discussions. The outcome of this was this document, which each osteopath, including myself, received. It was a consultation document, or a document that the ASA put together in an effort to provide some clarity around what they felt was acceptable or not. We spent a lot of time in discussions with that, informing them, trying to educate them about osteopathic practice, and look at how, as I say, we could gain some clarity about what they felt was acceptable, and obviously challenge those areas that we felt required challenging. This document is not in any way encompasses all elements. It was very much specifically geared towards the level of complaints that were being received at the time, and hence is very much indicates in that direction. But it did provide us some clarity. It also did make a number of inroads, we felt, in allowing us to be able to talk about a wider breadth around osteopathic practice, as opposed to being shoehorned into this sort of list of approved conditions. Again, from the ASA perspective, they're not interested in restricting scope of practice. It's not about clinical guidance or anything in that nature. It is purely about advertising, and that's quite an important point, because it is a concern, quite rightly, of a lot of osteopaths, and that certainly isn't the case for this document. One of the main things that we felt was quite important when we had the discussions was really to educate them, as I say, about the breadth of osteopathic practice, and that we weren't these just specifically one technique. We're not, osteopathy is not a technique, it's a profession, it's an expertise, we're primary healthcare practitioners. And that is something that the ASA did take on board, and we started to reflect in some of their terms. So one of the key guidance points, and why these were quite important, is if we go back to the point of the ASA providing guidance to osteopaths when all these issues started, we did see some, as I say, quite strong, significant sort of mitigation edits, which was starting to say, right, you can't mention children and babies at all. You can't talk about your diploma from the OCC or your paediatric qualifications, and that was something that we challenged really, really hard. And that's really where we've got our very clear guidance around the fact that we can claim to treat all patient populations within our communication materials. That goes from the babies right down through to the elderly. These are all obvious things for us as osteopaths, but they were important to get into the guidance to create that clarity. The other thing was around training and qualifications. We did a lot of work around explaining to the level and the high level of training that osteopaths undergo to achieve, whether it was a DO or an MSc or BOST or whatever we've all got. But also the postgraduate training, particularly in specific patient populations, such as obviously in paediatrics is one, women's health another. The other thing which we thought was very important was this, the what we call the approved list of conditions. Now, while that is something that we want to tackle in our phase 2 piece of work, that list of conditions, again, one of the gains that we got from them was around saying that, you know, that isn't patient population specific. You know, if we can say these conditions, we can say we can treat those conditions across all those populations. We can provide health advice, which was another area that they were trying to suggest was implied in efficacy. And we were saying, no, you know, part of our role as primary healthcare practitioners is to provide advice for our patients and those that are seeking osteopathic treatment. And around descriptions of treatment techniques, and that includes cranial techniques as well. So those are the 4 points that are mainly covered in the consultation document. We're not saying it's perfect. It certainly doesn't cover all aspects, and as I say, there are areas that we are also going to test also through our own communications at the Institute. So we're doing a lot of background work at the moment around our website, and what we'll be doing is using that to test some of the statements that we wish to challenge, so that it's not the osteopath that has to do that. We want to have that, you know, if there's going to be complaints, we'll take them rather than the osteopaths. What it has made us do is think about how we promote our services, market our services to whether they're potential patients, existing patients. And the one thing that we felt talking to lots of osteopaths is, you know, this idea of being a list of conditions. And it's something that we feel we want to move away from. You know, osteopathic treatment isn't about, you know, treating a condition. We treat a person, we treat a whole, you know, we are dealing with, you know, to use that holistic approach, but, you know, we are treating people. We're not treating an elbow or a knee or you know, those lists of conditions. And we're not what we do, we're not our intervention, it's about our skills and our expertise and what we bring with that. So it's how can we do that? How can we look at that? So our thinking currently is that actually, you know, how can we move away from being shoehorned into this list of conditions and really demonstrate the, as I say, the level of expertise, our role as a primary healthcare practitioner, you know, what else we do, you know, how many osteopaths have picked up other issues, other conditions in their screening of their patients and onward referral, those sorts of things. Which we felt, and we put into osteopaths, does it better reflect what we do? Is it a better reflection of what we do as osteopaths rather than a tick box of conditions? So we're looking at really changing the conversation around osteopathic care to, as I say, move away from this very sort of shoehorned, limiting area. We've done a little bit of work, and there is this model. I think this is quite interesting. It's one of these American sort of guru type people, which I'm not always a great fan of. But this guy, Simon Sinek, he has taken the model of good leadership, good communication, and looked at those organisations that have done it very well, and said, you know, what is it that's common about what they do and how they communicate. And what he's come up with is that the old sort of model for marketing, where you say, you know, this is what we do, this is how we do it, is actually, you know, it is an old model. It is very much the old thinking of marketing. And if we think about more successful ways of communication, what we find with more successful organisations is they actually start with what he calls the why. So it's why are we doing these things, not what are we doing. You know, why do we do what we do? We do what we do because we want to improve the health of our patients. We do what we do is because we want to support and make people as healthy as they can be. We don't do what we do, we don't talk about, you know, that's the model that we're trying to look at. Now if you do, it's on the TED Talk, it's on YouTube, he does a 20-minute version and he does a 5-minute version. And he actually takes the example of Apple, which is quite interesting because sort of, you know, it's a well-known company, very high profile. And what he says is actually, how does Apple get its loyalty? How does Apple get its market? It doesn't say what it does, because what it does is a phone. You don't buy Apple because it's a phone. There's hundreds of other phone companies. You buy Apple because of what it stands for, what it represents, what the values that it does. Well, certainly people that buy into Apple. I'm a Samsung girl, so it doesn't really apply to me. But it's taking some of this best practice and saying, well, okay, what does that mean for us? How can we use that? And interestingly, I think in normal marketing terms, when you're marketing that, that product, that tin of beans, whatever, it's sometimes very difficult to work out what the why is, because people are going, oh, well, it's about money and it's revenue generation, and that's not really the why. That's obviously not why you do it. But for us as osteopaths, I think it's actually really easy, because yes, we have to earn a living, but actually what motivates us isn't, how much is the bottom line. So we think this is a really quite interesting model to explore. And it also, what it allows us to do, I think, is move away from this tendency to have our profession shoehorned into this list of conditions and this, very small piece of world. And maybe we can talk a little bit more broadly about what we do more appropriately. And this is all, is well within what we're able to do with any regulation. We are talking about facts here. We're not trying to mislead in any way. So what we want to do is talk about health, which, as an my view of osteopathy is what we do. We promote health. And there's some other elements that we think we should be starting to think about, which sometimes possibly we don't value in the same way that we do when we talk about our ability to improve people's health. As I say, the role in screening I think is incredibly important, and what we do. People self-refer to us. We've all had instances where we've picked up things that maybe others haven't. It's part and parcel of what we do, but actually, how much do we actually, talk about that? Patient assurance, I'll talk some numbers at a moment, our patient advocacy for what we do is incredibly high. We know our patients have a good experience, high satisfaction rates, and the outcome rates are also incredibly good. And these are things that we can talk about quite happily. There has been some research around this, and we are going to conduct a little bit more. GEOS did some work with patients about new patients or people that hadn't heard about osteopathy. What would drive them? What information would they need to go and seek treatment? And these were the sorts of 4 questions that came out. Positive experience. We've got some really good statistics on this, and you'll know from your own anecdotal patient list that people have a good experience. Does it work? There are outcome measures. There are now tools available to osteopaths where you can measure your outcome measures very, very easily. You don't even have to do them. It's just a case of the patient filling out a survey, which will give you that data. How much does it cost? Obviously, is it safe? Again, we know in osteopathic practice is incredibly safe, and there's the research to just demonstrate that as well. What do patients value in their healthcare practitioner? It's our expertise, it's our time. The Osteopathic International Alliance actually did some research over in the US about what osteopathic patients valued about their osteopath and their experience. And actually, the results were actually different than they expected. It was about their expertise, it's their level of knowledge. It was the time we have with our patients. If you think about the time that a GP has, or even a nurse practitioner, it's very limited in the NHS. Minimum osteopaths spend at least half an hour with patients, and that's really valued by patients, and it's the sort of thing that patients value. Accessibility. Struggle saying that. Again, self-referral. People can normally come to us within very short notice. We are accessible. We are there. We've all had that situation where we've had a patient phone up and go, "Oh, can you just fit me in?" Or just, "Would you mind having a look at my son, my daughter, my husband, my wife?" We are there. We are part of our community. And again, this idea of health screening, health advice. So this is the information that research is starting to tell us that patients want to know. So this is the sort of thing we're saying, well, if this is what patients want to know, this is maybe what we should be also talking about. What we're doing, and this is literally hot off the press, so you guys are the first to see this, is there's a couple of different things that we've been working on to support our members. We're doing a review service for websites and leaflets where we will review any members for free, their website and their leaflet. We will look at it by way of ASA compliance just to check that. But more importantly, what we want to try and do is to help you in thinking about what are other ideas and topics and areas of content that you can use and really use to really demonstrate as a safe practice. What we've done is basically collated a lot of research that we've been going around talking to the NCOR and other organisations and saying, well, you know, what have you got out there? Let's bring it all in one place rather than you guys having to sort of run around and trying to search for it. And we've popped it all into this resource. Now, obviously, we are not a regulator, we are not the ASA, we're not claiming to be. What we want to do is help you be able to communicate what you do. But we also want to be able to, provide a level of help. You know, our advice as far as the ASA is concerned, it's not going to guarantee anything, but we like to think because of our conversations we have some level of insight that we can help you with. The copy advice service that the ASA provide, which is really useful, but it is about mitigating risk. So it's not going to give you advice on how to help you, it's just going to tell you what you can't say, and that's obviously not very useful, really. What we want to do is help you say what you can say. So this is, as I say, hot off the press. It is free to all IO members, and we can do that. There's an email that we can do for that. Going back to some of the research that we have collated and some of the numbers, 96% of respondents are satisfied or very satisfied with osteopathic care. You know, these are consistently in all the different types of reporting tools coming through. GIOSC are introducing clinical audit into the enhanced CPD, which is, another topic. But actually, it is a useful way of not only auditing your practice, but actually getting some strong data for your practice that you can then use within your communication materials. Because, as I say, it's very, very rare that we see that any patient satisfaction numbers come out low for osteopathic practice. You know, it is very high satisfaction and experience. So, PROMs, patient-reported outcome measures. People relatively familiar with that? Yeah. Something we are really trying to encourage. It isn't difficult in the fact that once you register, it's really down to patients, obviously to fill out the data. We are providing some more advice for people if you're not sure about PROMs, but it really does provide that data, provide you data on your own practice, but also provides us data nationally that we can use when we start engaging, whether it be the NHS, whether it be with insurance companies. It's really incredibly valuable. So I'm sure this has been said again and again, but if you're not registered with PROMs yet, it is something that we would really like to encourage as many osteopaths as possible to use. This is all PROMs data that we're using here. Sorry, I've preempted myself. So PROMs, what it will do, it will help you meet enhanced CPD. Easy, clinical audit, you get your report, you don't have to do anything else. It gives you data on your practice, and also it helps us on a national level to data. So there are three, we think, quite strong motivators for getting engaged with the PROMs tool. And it's easy. You register, you get your information pack, and you get your report at the end. This is the pathway for the patient. Post-treatment, 1 week, 3 weeks, 6 weeks, I think. And we've been putting together, again, a lot of advice addressing some of common questions that people have concerns about around their practice. So if there is any, I'll try and certainly help it in the break. These are the questions that gets asked, so your access to appointments, duration of symptoms, changes in health, change in symptoms, and as I say, satisfaction and experience. And patients are happy to do it. They're happy with their treatment. They're going to be happy to help you. So as I say, it really is something that most patients are generally quite happy to get involved in. And as I say, the early indicators, even with the outcome measures, let alone satisfaction, are high. If we look at the percentage level here for most improved, completely improved, and this is just after 1 week post-treatment. So the numbers are good. Okay. Patient assurance, as the data from patients says, for those that aren't aware of osteopathic treatment, is it safe, is it okay? Then there are high trust rates. This is again data that's come out. Amongst osteopathic patients, 97% express confidence in their osteopathic treatment and advice. Osteopathy is safe for treatment. This is all stuff that we can talk about. It's all in the advice leaflet. If you're an IO member, if you demonstrate a patient charter, which gives sort of a level of customer service, basic things that you do day in, day out, but it's something that you can put on your website that demonstrates the level of service that you will provide for any potential new patients who maybe aren't aware of what osteopathic treatment's like. It covers things like, we will discuss your treatment plan and come with an outcome you're happy. As I say, things that, these aren't new standards, this is stuff that you're going to be doing on a day-to-day basis. But for those that aren't aware of osteopathic treatment, it provides that level of assurance. As far as the IO is concerned, we've been trying to develop partnerships with other organisations around some of this health screening, health advice area. We ran the National Osteoporosis Campaign last year. Again, that's all about health screening. Loads of resources. There's CPD around that to become a fracture prevention practitioner that's available. There's information that you can download off the website to put into your clinic. So again, it's just sort of demonstrating the breadth of practice that we can provide, particularly if you are operating with a slightly older age range. This year we have partnered with Public Health England to support their campaign, which is around healthy behaviours, predominantly targeted at 40 to 60-year-old adults. This is about, yes, that's physical activity, but it's also about stress, it's about drinking, it's about obesity. So again, this takes us out of this very narrow MSK activity perspective and really starts to demonstrate our advice that we can give as primary health practitioners across a range of just general healthy behaviours for our patients. This is probably, this is stuff that you will normally do day in and day out in practice. If you're talking to patients who, maybe do need to look at their activity levels or their diet and those sorts of things. But again, we've got a number of different resources coming through that can support you to do that, and you can either post onto your website, put up into your clinic, and use with your patients. The other aspect that we're looking at, as mentioned before, is we know that there's this high patient advocacy. We know our patients really appreciate what we do and appreciate the services. It's really harnessing that. For those of you that may or may not be on social media, it is the platform of choice at the moment. It's not for everybody, but if you are using social media, we are encouraging osteopaths to get their patients to share their positive experience on social media using the hashtag osteopathyworks. What this does is starts creating momentum. It starts getting people talking positively about it. It's sort of using patient testimonials, but on the online platform. And again, this is all happening already. And if you are on social media and you put that in, you'll see some of the positive aspects that's coming through. So this is not about us promoting osteopathy per se. It's letting our patients talk for us. Again, there's a lot of resources and guidance available from the IO website. So coming back round, what's next for our discussions with the ASA? We are still in open dialogue with the ASA. As I said at the start, we're looking at around evidence thresholds for addressing the current list of conditions. The Advertising Standards Authority and should I say the Committee of Advertising Practice, CAP, who are the ones that actually put the code together, are currently reviewing their threshold for evidence. We were expecting to get the consultation document late last year, early this year. It has been delayed. We've been assured that it is a piece of work that has been going on, and we will be consulted, along with a number of other, we think, significant stakeholders Certainly NICE, I think, is going to be a really interesting one, because we know even with the National Institute of Clinical Excellence, their guidelines are based on best available evidence at the moment, not always at RCT level, because that is not always going to be available for even their interventions. So I think, generally mainstream health is moving away from this idea and really more looking at, again, certainly the King's Funds has made recommendations about actually addressing the true nature of evidence-based medicine rather than this purely very narrow measure. Once we have consulted on that and we understand that, then obviously we will then be looking at addressing this, what I call the approved advertising list. We will obviously be looking and consulting at where our priorities may lie with that, because obviously the list at the moment is what it is, and there's a whole other range of things that we can address. The other thing that's not on here that we will be doing, as I say, we will be updating our own communication materials to again reflect some of these much broader breadth of osteopathic practice, and as I say, if there are areas that we want to challenge, we'll be using the IO website to use that with the ASA so that we can challenge with that. Some key contacts here for the Institute and the website review, comms@osteopathy.org. For PROMs, it's Carol Forbes at QMUL. I can give you all of these, or the presentation will be available online and after here, and some other useful links. So thank you for your time on that. I am going to just sort of open the floor to questions now.